So I am Amanda Allard. I'm Assistant Director at the National Children's Bureau, and I would like to extend a really warm welcome to this conference this afternoon, which is all about Headstart and the amazing work that the sites have done over the past few years, but also in particular what they've done during COVID-19. Hence the title of the conference. So it's been really exciting and somewhat scary to have had so many of you sign up today. It did cause us a few challenges with platforms as we tried to swap platforms so that we could open up more spaces, and then discovered that that didn't work for the speakers, so it wasn't really an option. So we will be looking, obviously partly depending on the fee, but we'll be looking at how we can do some more sharing like this of what the sites have been doing. So and promise to make sure that that we find a solution which enables more people to join. And what I was just going to say, one other thing about, so obviously we've got the chat function, so please do use that during the day. It is quite tricky with the number of you that there are sometimes to keep a track on the chat function. So if there's something really important that you need to say to one of the speakers or to us during the course of the day or the afternoon, then do, and it's not being picked up in the chat, then please do raise your hand and we'll deal with it that way. So it has been an incredible privilege for us as delivery partner for the National Lottery to work with the Headstart sites and understand more fully the amazing work that they do to support children and young people's emotional well-being, and to do that during such a critical time for that work. The pandemic has really brought the children's well-being and issues around children's well-being to the fore. So it just felt like such a timely opportunity to hold this. Sharing is what we at NCB think we do best, and what we really wanted to do this afternoon was provide an effective stage for the sites to share what they've been doing with you. And we're also delighted that Scott Hignett from the Lottery will be presenting an overview of the approaches from the sites and the journey that they've gone on together. So that's kind of what we're going to be doing in terms of the Headstart sites. But we also wanted to make sure that you understood the national context as well. So really delighted that we've got some civil servants along so that they can share what they've been doing. For those of you who work closely with government, you will know that the civil service colleagues have been working incredibly hard, not only at the pandemic response, but also doing what they can to keep business as usual show on the road during this time. So just really important that we get to hear from them about what they've been doing. There we are, which brings me on to digital housekeeping. So as we've already sort of addressed really, but it is a large conference, so if you can please turn your cameras off and keep mute unless you have been called upon to speak. And use the chat function for questions. We'll be asking, unless we do find that we have enough time for sort of a little bit of interactive questions and answers, we'll be asking the speakers to pick up questions in the chat themselves and do responses in the chat. The conference, including all of the workshops, will be recorded. If that feels uncomfortable for you, then please just, if you keep your camera off and if you don't speak but just put things in the chat, then obviously you won't be part of that recording. So hopefully that feels all right. It's just, it was so clear that there were so many people who wanted to come today who either couldn't or for whom we couldn't provide a place, that we just wanted to make sure that we had the opportunity to share more widely. You should all have received 2 workshop invitations. If you haven't, then can you please email Tamara, and Tamara's email address is just there on that slide. And if you want to share any resources, then please do put those in the chat. We had an amazing event last week, which was a meeting that we did with the Partnership for Schools Wellbeing and the Coalition for Children and Young People's Mental Health. And there, so many people shared so many amazing resources, and we do have a list of that which we will send around. But it just feels as though what is really important right now is that we make sure that everybody knows what is available that might be able to help them with things that they're struggling with, so that we don't all have to reinvent the wheel. So so do please share resources. One other thing, we have sometimes found with some of these large meetings that some people find a glitch with the chat function. So if for any reason you're finding that the chat function isn't accessible to you, then if you can again email Tamara, and then she can cut and paste any comments that you might want to make in the chat. Hopefully it won't be an issue. It wasn't yesterday, but I just didn't want anybody not to have a voice because of that. So obviously it's 2020, so there will be tweeting going on. So that is the conference hashtag. If you want to tweet about anything during the conference, then please do so. You know, I just think what seems so clear at the moment is that there's so much great stuff going on, and there is literally not enough that we can do to share it. So if we can get some of the stuff out on Twitter as well, so much the better. And maybe make sure that some of the people who can't be here with us today or didn't even know about today can then catch up with the recordings at a later date. So that is social media. This is the agenda, which hopefully is not a surprise to you and was what you were expecting. Just to say the briefest bit about NCB, because today is really not about us, but the reason that we're here at all and one of the sites isn't chairing is because we are the Headstart support and development provider for the partnerships. So that means that we're in the lucky position of being able to offer them support. Mostly, I have to say, what we really do is provide them with opportunities to tell each other what's going on and share across. But we're also, I guess, because of the work that we do across a number of different areas of children's policy, sometimes we've been able to support them around their sustainability and legacy ambitions, because we're aware of other opportunities that might be ongoing, things like social prescribing that actually maybe aren't slap bang in the middle of what they're doing, but actually are contiguous and you know and might present an opportunity for them. So really helping to do some knitting across some of what Headstart are doing and what other opportunities there may be. So that's a little tiny bit about us. And then just in terms of our wider work, we just wanted to, as I said, I mentioned the Schools Wellbeing Partnership earlier on and a meeting that we had last week. But this is what we're doing at the moment, is making sure that schools are aware of sorry, not schools, that government is aware of what schools need in terms of, and what children, young people more importantly, need in terms of support around mental health and well-being in schools. And really calling on government to make sure that vulnerable children are the centre of that strategy. And it feels really, really important now, more than ever, to make sure that everybody is aware of behaviour as communication. And that we don't have a punitive approach to behaviour when actually it's a cry for help. The other thing that we've been talking to government around is workforce development and a workforce strategy to include staff wellbeing, training, recruitment and retention. So that's just a sort of bit about, it just feels really important that you are kind of aware that whilst we're supporting the sites and local areas, that actually what we then try and do is make sure that what we understand that either schools or local areas are struggling with, then we then feed that back up to governments, that they can then sort of understand that when they're developing their own strategies. So sort of trying to develop a virtuous cycle, if you like. So lastly from me, I promise, and I've got no idea how I'm doing for time because I can't see anything, is just to set a frame for today and why it felt so important that we give the Headstart sites an opportunity to share with you. So we know that mental health needs are increasing for certain groups of children, young people at this time. So Young Minds have done an amazing survey. It's really, really good response rate, but quite scary. In the 80% of those children, young people with pre-existing mental health conditions said that the pandemic had made their mental health worse or much worse. So it was a survey of 2011 young people with a history of mental health problems. So the other things that they found were that 69% of respondents described their mental health as poor now that they're back at school, and that's risen from 58% before the return to school. 40% of respondents said that there was no school counsellor available to support students in their school, and only 20% had had a one-to-one conversation with a teacher or another member of staff in which they were asked about their well-being at the time that they completed the survey. So that's kind of, against a backdrop of concerns about all children and young people's mental health. So I just think just really, really important to understand. We have been so incredibly impressed by all of the professionals that we've talked to in recent times about how hard everybody is working and how everybody is identifying solutions and workarounds and fixes that support children and young people and ensure that they do get the services and that they support that they need whenever that they possibly can. So today is really just about making sure that we enable some of you to share with each other some of those fixes, so that, as I said earlier on, we're not reinventing the wheel. And just to make sure that, in terms of that sort of that bottom bullet point, we know that schools are at the front line. We know that they don't always feel fully equipped to deal with some of the emerging challenges, especially some of that the more heavy end things where children and young people may have experienced bereavement. So just a really good opportunity to bring together the experts in the field and do some of that sharing. And I think, hey, that is me done. So I am now going to hand over to Daniela and to Claire. And hopefully I'm going to stop sharing so that they can, oh, there we go, stop presenting, so that they can share. Danielle, are you going first?
I am, and I'm attempting to share at the moment as well.
It looks like you're not simply attempting, but succeeding.
Oh, well, there you go. Well done, me. Good start. Okay. So, hi, everyone. Thank you for having me here today. My name is Daniela Durso. I lead the People Mental Wellbeing team at the Department for Education. So, I'm here to talk to you a bit today about what we've been doing kind of throughout the pandemic and the lockdown, and how we've changed kind of our focus looking to the future, and to give you a bit more information about that. And I'm joined by Claire from PHE. If you want to introduce yourself now, Claire.
Yes, hi colleagues, delighted to join you today. I'm Claire Robson. I'm Programme Manager for Children, Young People and Family, part of the national team at Public Health England. I lead around improving outcomes of school age / adolescent population, and that includes a focus around mental health and wellbeing.
Thanks. So I think, as Amanda said at the start, I think we're both happy to take questions if people want to post them in the chat function, and we can pick them up at the end. I think from the DFE perspective, I'm here representing several teams, so I can't promise that I'll always be able to answer questions, but I'm very happy to take things away and come back if there's anything that I can't answer that gets asked during the session today. So starting off with, sorry, what is a massively busy slide, but just to set up now, and actually just to echo what Amanda was saying just before she introduced us, I mean, so we know what a huge challenge you've all faced since schools closed, trying to kind of educate and kind of keep an eye and look after your pupils and young people remotely. It's been a massive challenge, and I know that it's hopefully starting to kind of get easier as people are back in school, but we know that there's still massive challenges ahead as we go into the winter. So so thank you for that. But recently this month we have published our second annual State of the Nation report looking at children and young people's wellbeing. The idea of this annual report series initially was to kind of take a very broad look at children and young people's wellbeing and to kind of see what the existing data could tell us when looked at as a whole. But obviously this year things have been quite different. So the focus this year was very much on the experiences that children and young people have had of kind of during COVID. The data that we looked at was very much focused around the lockdown period. That was the time kind of time series that we had available to us. So it doesn't really cover anything about the last couple of months of return to school and the impact that that might have had. But what the report tells us, which was quite surprising in some ways, that was that a lot of elements of children and young people's wellbeing have actually stayed quite stable. So children generally feel quite happy with their lives and happy with their family relationships, and their personal well-being generally tends to be okay. There have been some decreases in subjective well-being and increases in anxiety, but possibly not as much as we would have thought. Although we do recognise that that might be due to limitations in the data. So obviously a lot of the data collected at this time is less robust than people would normally want it to be, or covers a smaller sample. So we don't necessarily have breakdowns into subgroups that might be showing different impacts. And we do also know that there have been impacts in areas such as worrying about the future, worrying about friends and family, worries about money for either your people or with family, and also a lot of concerns around loneliness and isolation from friends. So hopefully we'll start to see some improvements there as children have started to go back to school from September, because a lot of the concerns around loneliness and isolation, and also things like missing education, hopefully will start to be reassured now that the children are back in school. But as Amanda was saying at the start, schools are at the forefront for a lot of the issues that children might be facing as they return, and a lot of the things that kind of might emerge over the coming months. So I'll talk about this in a bit more detail later on, but we have just recently introduced our new Wellbeing for Education Return project, which hopefully some of you will be aware of as it starts to kind of filter down into local areas and then be kind of implemented in schools. But we do recognise that it's not a new problem, and it's not a problem that's going to go away anytime soon. So we do also remain committed in the longer term to our green paper proposals, which again I'll talk about in a bit more detail later on. But yeah, I think we're now in the department kind of moving from worrying about kind of how do we support in the here and now in such an unusual situation to kind of getting back to kind of delivering these commitments that are long overdue in many ways. I put a bit on here about what we've done across government in response to the pandemic, kind of while schools were closed. I won't kind of dwell on this for too long, not least because Claire's going to talk about Every Mind Matters in a moment, so I won't steal her thunder. But I think just again to echo what Amanda was saying there, I think we've found actually really good success within the department for doing things in a different way. So we ran a few webinars over the pandemic, over the lockdown period, which isn't the sort of thing that we would normally be able to do, and certainly not as quickly as we did pull together. So I think it's given us that opportunity to kind of look at how we do things and to do things in a different way, and looking at how we can reach much bigger audiences. So I think the plan is for these slides to be shared afterwards. So we've hyperlinked to a lot of the resources that we either published or broadcast during the last few months. So it's definitely worth checking them out if you get the opportunity to, because there's a lot of support and advice on just kind of how to deal with issues that children might be facing kind of now or in the coming months. I'm going to hand you over to Claire now to talk a bit about Every Mind Matters.
Thanks, Daniela. For colleagues who may not be aware, last month, the 8th of September, we launched a new campaign around supporting children and young people's mental well-being and improving mental health literacy. It was developed in response to increasing concerns about the impact of COVID-19 on CYP mental health, but the intention is that it's created what we call an evergreen content and a hub that will remain beyond the pandemic. We established an advisory group with key charities to advise on the campaign strategy and to identify content to signpost to. We're very mindful that the voluntary community sector play a key role here, have really good information available for parents, for direct to young people, and for staff in education settings. So our goal was to be able to drive through a signposting function to some of that material, as well as hosting information on the Every Mind Matters platform itself. So development was quite rapid over a period of 2 months, and all the content was tested both with adults and with children and young people. And the research was weighted towards populations most at risk, including BAME populations, and charity partners played a key role in that. So just to give you a flavour of the impact to date, the schools and youth activity have exceeded expectation. You can see summarised at the bottom of that slide some of the statistics in terms of reach and in terms of CTR is click-through rate. So, you know, people clicking and going through for further information. Although the element of the campaign that was focused specifically around parents, we did see that since return to school, interestingly, the parental, the percentage of parents accessing the information seems to have dropped. And that actually corresponds with some insights from Cabinet Office around that. And it may be that, you know, the protective function that schools clearly play in children's lives has meant that, you know, some parents have been able to kind of offset their personal you know, the weight of concern that they were carrying for their child's mental health and well-being whilst they were not at school. So we'd be interested to know whether that concurs with any insights that colleagues on this call hold as well. So that's just a bit of feedback on the campaign. Daniela, if you want to move the slide forward, I can touch on PHE's real-time surveillance report as well. Are you able to move the slide forward, Danielle? Thank you. So this, again, is just to highlight as a resource in case colleagues are not aware of it. PHE has published as near to real-time surveillance report about population mental health and wellbeing in England during the pandemic, as we are able to. So we draw on routinely updated indicators from multiple sources, different research that's underway, and try to pull together and report headlines from that. So the format, as you can see on this slide, is presented as a series of short reports, and there is a report on children and young people, and you might wish to view that. I've included the link that should take you directly to that. But yeah, some of the headlines concur with, you know, some of the headlines that Amanda was alluding to, particularly the health and well-being of younger adults in the 18 to 29 age bracket, really reporting worse mental health and well-being outcomes when compared to middle and older age adults. And that's across a range of indicators that we've reported on: anxiety, depression, life satisfaction, loneliness, major stress, self-harm. There are gaps in the data, clearly, and this is a moving picture, and we're drawing on new data sources all the time. And I think pretty imminently there'll be a significant contribution to this data set through the update of the National Mental Health Prevalence Survey for children and young people, and the focus that there has been around young people's experiences around COVID, and that's soon to report. So that information should be reflected in this report over the coming weeks. And I think just moving on a slide, I wanted to make you aware of a series of reports that PHE has published around COVID-19 and vulnerability. And whilst we're talking here about wider health and wellbeing, I know in the context of this conference, we wanted to just make you aware really that these reports, No Child Left Behind, was something that we published again last month. There are 3 documents to look at, a public health approach, a report that talks about understanding and quantifying vulnerability in the context of children and young people's lives. And then a vulnerabilities narrative report, which may be of interest to you, as it presents upper tier local authority information focused around indicators of vulnerability and looks at both risk and protective factors for children. So you see on this slide 3 high-level categories of vulnerability identified. CYP who might be at high risk due to clinical reasons, children who might be at high risk who have a statutory entitlement for care and support, and then those who might be at high risk due to wider determinants of health and other factors leading to poor outcomes. And this conceptually arrived at as a helpful way to frame vulnerability through collaborations with NHS England and other parts of the system in which we're operating. So hopefully that'll be a useful tool to you. And I think at this point, I'm passing back to Daniela.
Daniela, you're on mute.
Sorry, I was just unmuting myself to tell Daniela that.
Yeah, thank you. Sorry. So yeah, sorry. I briefly mentioned before the Wellbeing for Education Return package, but just to give you a bit more detail now. So hopefully people will have started to have heard of this and to have seen it in local areas. I think the last stats that I'd heard, I think 100% of local authorities had named an expert to kind of undertake the training, and I think over 90% had undertaken training. So what the package consists of is training materials that have been developed at national level, but then are able to be tailored and delivered locally by local experts who understand the context that their schools and colleges are dealing with and the particular challenge that they face. So it's a 2 webinar kind of trainings package that's delivered to the local experts, looking at kind of the whole school approach and kind of how to support mental health and wellbeing throughout the school, and then also taking a more detailed look into some of the issues that that children and young people might be facing. So thinking about trauma and bereavement and kind of how that might present and what a school should do, and in particular looking at how to identify where issues maybe do need further support or intervention, but understanding that for a lot of children and young people, they might be more anxious than they might have been before, or they might be feeling a bit worried about the future, but that's in most cases it's a very normal response to the situation that we're in. So it's about kind of helping them to have the confidence, or you to have the confidence to know when and how to intervene if it's appropriate, but also kind of how to support people where you can. And the idea of this very much sit alongside the reforms that we're bringing in, so the Green Paper programme, which I'll talk to you about in a moment, and also the new mental health content that will be delivered in schools through health education. So very briefly on the Green Paper, the 3 commitments are to put mental health support teams or make mental health support teams available in 20 to 25% of the country. We've rolled out a number of teams already, and there are more teams currently undertaking training. Obviously, things were stalled somewhat by lockdown, but we're getting things back on track now. And there were a number of teams already in place working with schools, and we've seen some really good examples there on the right hand side of how those schools adapted their services and were able to support pupils and learners who weren't able to attend school remotely, and how again, I think that's a model that we can learn from in the future, so that while schools were closed, there was still that ongoing support available to them. Obviously, the mental health support teams are in quite a small proportion of the country at the moment, but I think it's a good starting point, and it's a good kind of way for us to look at what works and kind of think about, as more teams get introduced, kind of how we can adapt the model. Throughout the pandemic, we also adapted our LINK programme, which we're rolling out nationally. The LINK programme looks at bringing together education and health staff in the local area to really build relationships and improve joint working, so they can understand kind of who they need to contact, where the barriers are, and how they can best work together. This was something that we recognised was really key during the lockdown period, in particular, where people kind of weren't able to access the same kind of resources and channels as they had been previously. So the programme was adapted and delivered online during the pandemic. I think the feedback that we've had so far is that it's been really well delivered. People have been kind of pleased to have the training of the programme available to them, and it has been working as an online resource. So it's great to see that the programme is still being rolled out and people are still benefiting from it as as we've been through this really difficult time. And then the final DFE-led commitment from the Green Paper was training for senior mental health leads in every school and college. So the department is still very committed to doing this. I think over the pandemic and the lockdown, we had to prioritise kind of putting the bespoke training in place for schools as people started to return, which is why this work paused slightly. And we focused more of our efforts onto getting Wellbeing for Education Return ready. But we are now kind of back on track with looking at senior lead training. And what the last few months have done has given us a bit more of an opportunity to kind of learn from how things have changed over the lockdown period, and kind of how the needs of schools changed, how the way that schools would like to access training, and the kind of the ability to kind of the time that they have to spare on training, and whether they'd like to do things physically or online. So colleagues of mine, who you will see hyperlinked at the bottom of the page, are currently doing some user research, looking at current needs and how schools would like to access training, what sort of things they would like to be covered in the training, what sort of people you think are best placed to be senior leads in schools. As we know, it's going to be kind of an additional role for someone else who is already working on other things. So I would really encourage you to touch base with them after the session if you'd like to be involved in that and you'd like to kind of feed into what that should look like, because we're really keen to not really be led by our previous assumptions on what that role should be, because we're aware that the world has changed. It's quite a quick process we're trying to work through, because obviously we know that people are very keen to have this training made available to them. So if you'd like to get your kind of get your voice heard in this process, then I would encourage you to get in touch, but to do it quite quickly. And yeah, they'll be in touch with ways to do that if you contact them. So then also from the Green Paper, the NHS have been trialling 4-week waiting time pilots. This probably would be the area that I know the least about, so I can't add a huge amount to what's on the slide. I don't really want to read it out to everyone when I know that you're all very capable of reading it yourselves. So I'll give you a few minutes to read that one. And if people have questions, comments about this commitment in particular, then I'm very happy to take it away and discuss with colleagues at the NHS and see if we can get you any answers.
thanks, Daniela. I'm sure people appreciate that offer.
Okay, cool. And again, the slides will be sent around afterwards. So if people have any questions, please do get in touch. So then this slide is just to kind of bring it all back round to a whole school approach and to look at kind of how we're trying to support schools and local areas to kind of look at everything that they do through a mental health and wellbeing lens, rather than it being seen as an add-on or additional burden or kind of something to be looked at in isolation. So this model here is something that we've developed within DFE, and the categories along the bottom are kind of the principles to a whole school approach set out in the PHE guidance. So we've tried to map the kind of the roles that schools generally play across to the principles of a whole school approach. And I think what our big focus moving forwards from my team will be around kind of how we help schools to kind of put these pieces together. So a big part of that is working with colleagues from across the department to make sure that we're really consistent in what we say, and that our policy work is complementary and it doesn't it doesn't contradict itself. So I think the example that Amanda gave in the introduction around behaviour is one that we hear a lot about, and it's one that we're really we're working really closely with colleagues on behaviour to make sure that we are really consistent in our messaging there, and that that behaviour as a means of communication is actually kind of really clearly reflected in their guidance. So so obviously from their perspective, they need to look at behaviour and discipline and how to deal with challenging behaviour, but we're really working with them to make sure that it reflects the need to actually understand what is driving behaviour before kind of taking a more disciplinary route if it is an unmet need that's causing it. We're also working very closely with colleagues who lead on staff wellbeing now. So you might have seen that they last year had an expert advisory group established, and they've the group produced a series of recommendations, I think, which the government has agreed to all of. So I think the first one of those is a staff wellbeing charter that will be coming, I think, in the next month or so. So that's something where education settings can sign up and kind of commit to supporting staff wellbeing, and it also comes with commitments from government to do the same. So to make sure that in our policy making that we're not kind of adding additional burdens in where they're not needed, and that Ofsted inspections aren't placing excess burdens onto schools. So I think that's a really positive move. We've also, I mentioned relationship, sex and health education, which has now been introduced, and again throughout the lockdown period, the mental wellbeing teacher trainer module was fast tracked for publication. So that was published in June, and again that's because we knew that mental health and wellbeing is a real it's a concern in terms of children coming back to school, and it was also one of the areas that we'd had feedback previously that schools were least confident to deal kind of to teach. So that module was brought forward and published early to give schools the knowledge and confidence about what they needed to deliver in the curriculum, and also as kind of thinking about their COVID response and how to time the elements of the curriculum kind of to meet the needs of their pupils that they were coming back with. And then I think the other kind of the big thing from our perspective in the next few months will be how we work with the special educational needs team, disabilities team, on their review that's upcoming, and really making sure that mental health is reflected throughout that. So obviously we have social, emotional and mental health needs as a category of SEM, but also just looking at kind of how the SEM process can support schools in their whole school approach to mental health and wellbeing more broadly. So looking at the graduated approach and kind of how that can be used, well, should be used to identify any range of issues. Not you know, part of that process will be kind of seeing whether they've got SEM. They might not, but there might be that other routes of support are more appropriate. So we're really keen to work closely with them to make sure that that's as seamless as possible as well. I'm handing back to Claire now to talk a bit about some work that they're doing on mental health outcomes.
Thank you. Amanda, can I just do a time check? How much longer have we got?
You're doing really well. You've got another 15 minutes, so you might have
Okay.
time for some questions.
Yeah, sure. I'll just speak for another 5 minutes and then we can take questions. So I think my slides are the last ones in our input. So I just wanted to make colleagues aware of a piece of work that PHE is leading on around a mental health outcomes framework for children and young people. So this work arose from a document that we published last October, which was the report of a special interest group around children's mental health and prevention. And we looked at the literature, we looked at CYP views, we looked at some of the data that is reported through the Millennium Cohort Study. We listened to the views of practitioners, and we made a number of recommendations as a group, and that included a recommendation that really is when you look at our data and how we report data on children's mental health nationally, it's quite skewed and quite focused towards prevalence of mental health problems and access to services, with little routinely collected, robust and repeatable data sources around children's mental well-being. And not only that, the underpinning risk and protective factors across children's lives, across the families that they're part of, the learning environments, their communities in which they live, and wider recognition of structural factors. And so we wanted to look at this and make some recommendations and put forward some thoughts around it. So we brought together a project steering group. We have done some work around a conceptual framework, and you can see on this slide where we've got to. And what we are hoping is that this conceptual framework will then impact on, from a Public Health England point of view, our children and young people's mental health fingertips profile. And I'm sorry, I should have included a link to that, and I will, by way of follow-up, send the link. But for those of you who are not aware, the fingertips profile is a way that PHE presents existing data around a whole range of priorities, but there's one specifically on children and young people's mental health. And it enables local areas to view their performance across a range of indicators as it compares to other local authorities and national averages. So it also enables you to view it by CCG and other geographical footprints. But it's predominantly, when we look at children and young people's mental health, populated with data that's more focused towards, as I've said, prevalence of mental health problems, access to services. And we wanted to look more upstream at indicators around children's mental well-being. We wanted to also acknowledge cross-cutting priorities relating to vulnerability. And as I've said, identify risk and protective factors, as well as services. Daniela, would you mind just moving the slide on to the last one? We've constructed the conceptual framework, which is what you're viewing now. And you can see that there is a domain under learning environment. What we have done is we've reviewed a whole range of sources of evidence, but by that I do include CYP views, practitioner views, as well as literature, research literature. And we've identified some subdomains that are of interest in the context of impact on children's mental health and well-being. And we are unpacking that to look at, further categories that sit beneath the headlines that you see on this slide. There are massive data gaps at the moment. The basis of this, the fingertips profile, is that we try and achieve alignment between nationally reported data and local authority data. And we've got significant gaps, not only around reliable data that links to children's well-being, but our ability to generate that on a level that enables congruence with local authority as well as national reporting of that information. And we think it's worth pursuing that. And so we're going to be making some recommendations, and we're going to be publishing a reworked version of the fingertips profile in the new year. So it's just to make you aware of that, and I'm sure the work that you've been involved in would certainly have a contribution to make. So Jess Dayton has been on the steering group, and I know she's been involved with the Headstart programs as well. So yeah, I think that's probably as much as I will say on that, but it was just to make colleagues aware. Thank you.
Thank you so much, both of you. And I think that you, in your presentation, addressed a fair few of the issues that have come up. But there was obviously, and not unexpectedly, a lot of interest in the mental health lead training. I know that Gail was particularly keen that in terms of the consultation that you're doing on senior mental health leads, that you might think about building in some good practice and build on the learning that's happened in those areas that have got a similar role, and also a comment about whether or a question about whether or not there'd be financial support for the senior lead in terms of covering the pay remuneration which they'd need to be given. Is that something you can comment on, Daniela?
Yeah, so in terms of the consultation, it's we're looking at we're doing a range of different kind of engagements. So we've got kind of one-to-one user research with schools, and as part of that we are looking to target a range of schools, so different types of schools, different sizes, but also looking at schools who already have a mental health lead or leads in place, and those who don't, to try and get a kind of mixture of what people want to see and what's already happening. I did see in one of the questions that Pam forwarded actually about the size of schools and kind of the need sometimes for there to be more than one lead, and that's we fully do recognise that it's probably just a shorthand in the way we say it, but we know that in a lot of places it works really well where you have a senior lead kind of coordinating it, but supported by other people, and that's again something that we're not looking to kind of preclude or prejudge from the work that we're doing now. We're very open to kind of how the role should look, and therefore how the training should be structured. I think in terms, I mean, so the point around finance is something that we have looked at previously. It's not a mandatory role in the way that a Senko is, and that you don't have to have the same sort of qualifications. So although we are offering this training, it wouldn't be mandatory. So I think it's slightly different in that respect. But again, that's one of the things that we're looking at, and one of the questions that we're asking is around the challenges that schools have in this, and I think it is another role that's being put onto people at this time, you know, when people already have a lot of things on. So yeah, again, I think it's something that we recognise, but I don't think we have an answer for at the moment.
Okay, I'm sensing from the chat that people would very much welcome that there could be an answer, and that it might be a positive one, but I will leave you to work on that. We've got a couple of hands up, and we probably do have enough time. Andy Jones, would you like to come in?
Hi, yeah, thanks very much. Yeah, it's just my observation, having worked in schools as a schools counsellor, both in primary and in secondary settings, that if you put another role on to another teacher or a senior lead in the school, be it mental health or anything else, it's going to get lost. And that's been my experience, that actually there is an opportunity to put a qualified counsellor into each school. and actually they could then manage the mental health approach within schools, and it wouldn't cost a great deal of money. But I do think if you put it as an additional role onto very busy teachers, and my wife's a senior leader in a school, it's just going to get lost, and particularly in mental health schools.
Okay.
In primary schools, sorry.
Thank you, Andy. And I had somebody else with a hand up whose hand has disappeared, and whose name I didn't catch. I think it was it Claire? Claire, did Andy already make your...
Hiya. Sorry, I wasn't sure if you were going to have time. I'm just really interested to hear from both of you, if it's possible. How are young people themselves being involved in the initiatives and the things that you're talking about, so that all of this doesn't just end up being something else that's done to young people rather than done with young people?
Yeah, I can comment, Claire, in terms of the outcomes framework. It actually was spearheaded through consultation with CYP. So we worked with the Association for Young People's Health, and through them a wider partnership, the Young People's Health Partnership, and they conducted some interviews with 70 young people representing different backgrounds, contexts, harder to reach young people. And the premise was what is important in terms of keeping you mentally well, and listening to their stories behind that, and pulling out some of the themes about the protective factors and the risk factors underpinning their sense of mental well-being. So that was very much what sort of started the whole the basis of reframing the outcomes framework, and it's a principle that we hold dear within PHE in terms of listening to and co-production with children and young people. So it's an ongoing something that we will need to check back. But the way we do that, we have through the Health and Wellbeing Alliance some partnership agreement, and the Association for Young People's Health help broker that on our behalf with children and young people.
Oh, thank you, Claire. Now, very briefly, because we've got a couple of minutes left, there was a question about how it's decided which areas get a mental health support team. I don't know whether you can comment on, and also a question that I wasn't entirely sure I understood about victim narratives. So maybe the person who asked the question about victim narratives might want to jump in, but while they're putting their hand up so that I can call on them, Daniela or Claire, are you able to answer how it was decided, or how it continues to be decided which area gets a mental health support team?
So it's I'm not sure of the process at the moment actually, but the initial process was it was led by CCGs kind of applying for it to be for teams to come into their regions, and then there was a process of looking at kind of the geographical spread within that, what sort of spread and mix of schools they would get, how many kind of children they could reach within those. It was also in the early stages partially kind of led by where the training was available, and so you could actually have trainees training and then being able to support schools, and then once the areas had been selected, then they worked with schools locally to decide which ones would be supported. I think probably that has changed in time, because I think they're coming up to, or kind of working through the third wave maybe, so I think things probably have changed, but yes, there is a process of applying into it and making sure that the areas that get them are actually able to make the most use of them, so they actually have kind of the provision in place, and that they've got kind of the relationships with the schools to make sure that they work well.
Super, thank you. Very briefly before we move on, and sorry if you can hear all of the alerts on my laptop. Now, you've got your hand up.
Yeah, I was just going to confirm what was just being said. I'm working in Northumberland, actually as part of one of the mental health support teams. We applied in wave 1, and there were 2 areas identified within wave 1. My role is actually as a senior mental health lead coordinator. So I'm on secondment from my school, and my job as part of that is to help to provide support for those people identified as senior mental health leads within the school. We've also applied, the Northumberland CCG's also applied within Wave 3 and been successful with one additional area which is coming online shortly as a result of that. So it's through that application that people have mental health support teams. So the support team consists of some EP time. That not every mental health support team does use it as for educational psychologist time.
Thank you so much now. And just before I move us on to sort of the next section, if you like, of the afternoon, where we start to talk about Headstart in some more depth, just wanted to say thank you so much to Claire and to Daniela for joining us. Obviously, at this point, I would normally ask you to do the traditional clapping thing, but getting you all to unmute, so it just feels like that could be a complete recipe for a disaster. So I will just ask Daniela and Claire to feel properly thanked on your behalf, and thank you so much. And I'm going to introduce Scott Hignett from the National Even Lottery Community Fund, who is going to give us an introduction to Headstart before we move into the workshops. Thank you, Scott.
Yeah, and thank you, Amanda, and thank you to Daniela and Claire as well for some really useful, insightful information there as well. Yeah, just as a way of a bit of an introduction, my name's Scott Hignett, and I'm Head of Funding at the National Lottery Community Fund. And for those of you who don't know us, we're the largest funder of community activity within the UK. And we're underpinned by an ethos around when people are in the lead, communities thrive. And moving forward on that, we genuinely, truly believe that people understand what's needed in their communities better than anyone. So we will listen, collaborate and fund so that good things can happen. And ultimately, that's why we're proud to award the money raised by the National Lottery players across the UK. I know Daniela and Claire, some of the candidates talked about co-production and listening, and it's through this listening process that we effectively developed Headstart. So as Amanda said, I'll give you a bit of an overview of what the Headstart programme is, why we launched it and some of the learning to date. But I'll leave it to the capable hands of our 6 wonderful partnerships after me to talk through the workshops of how they've dealt with the impact of the pandemic and the learning that has been helped. So what is Headstart? Headstart was a 5-year programme to support young people aged between 10 and 16 who are at risk of developing mental health conditions. I say it was an originally 5-year programme. The National Lottery Community Fund recently awarded an additional year to the 6 partnerships, taking it to June, July 2022 with an additional package of 8.7 million. So the lottery's investment within Headstart programme now over the 6 years is 67.4 million. The reason that the lottery and our England committee felt compelled to make this extension is that we didn't want the services and support that these young people are currently receiving to be unduly lost when the demand is going to increase and probably peak. So that gives you an understanding of where the National Lottery Community Fund sees the success and need for the continuation of this programme, and hopefully today you'll have a better opportunity to hear more about that as well. So the Headstart programme, it's led through 6 local authority partnerships, namely Blackpool, Cornwall, Hull, Kent, Newham and Wolverhampton, who work collectively and collaboratively with young people, parents, schools, community organisations and other services to build a young person's emotional resilience from an early age and have a positive impact. So far the programme's worked in and around 430 schools across those 6 local authority areas and has been able to reach on around about 130,000 young people. So through Headstart, what do we hope it'll achieve through this ambitious programme? The first thing is that Headstart aims to improve the mental health and well-being of at-risk young people. It also aims to improve the engagement in schools and improved academic achievement. And finally, Headstart aims to reduce the engagement in risky behaviour from these young people. What underpins those 3 particular aims is this concept of proportionate universalism, which when we put that out to the young people, it wasn't very well received. So our young people in Kent put it a little bit more simply, and I think it's a wonderful phrase, is that everyone gets something, but some get more than others. So this Headstart program, our Headstart program, was based on the notion of test and learn, which was it was a very new thing for the funder, I think for a lot of other funders as well, to allow partnerships and grant holders to test and learn what they're doing without having to meet specific outcomes or targets. And for the first 3 or 4 years of this program, this has allowed our 6 partnerships to explore and be creative in their solutions to helping young people improve their mental health and well-being. For the remainder of the program, which would probably be about the next 18 months, what we really want the partnerships to focus on is to switch to a test and embed model, so we can ensure that the important learning and interventions from the program are adapted and adopted more widely. Our colleagues earlier mentioned the Anna Freud Centre. We too work with the Anna Freud Centre because they're our national lead evaluator, and they lead a consortium, the Anna Freud National Centre for Children, in combination with our own learning from the National Lodge Community Fund. We've started to develop some important information and principles that begin to emerge on how best to improve the mental health and well-being of young people. And it is some of these principles that I'd like to explore further with you today. In particular, there is new evidence that shows young people, particularly girls, are at an increased risk of mental health problems between the ages of 11 and 14, which is much younger than we previously thought. One of the delegates earlier talked about co-production. This is what we genuinely believe in that co-production is vital in the development and continuation of these interventions. And thirdly, that young people with more complex, chaotic lives need a trusted place and a trusted person to truly engage in the programme and thrive. So I'll be talking about some of the basic principles of what we found across those 3 areas, but at the end of the conference, we're more than happy to share with you the resources that I talked through today, and likewise share the contact details of myself and the 2 funding officers that are currently managing work on the Headstart programme, if you'd like to know a little bit more detail. So if we look at the first one, that young people, particularly girls, are at an increased risk of mental health problems between the ages of 11 and 14. So this particular statement has come from an evidence briefing produced by the Evidence-Based Practice Unit at the Anna Freud Centre, University Central London, and working closely with additional partners. What they found in particular is that emotional difficulties of girls escalate as they move from early to mid-adolescence. On average, their emotional difficulties increase by 17% between the ages of 11 and 14. This is in the contrast to boys who show fairly stable levels of difficulties, even decreasing slightly over this time. An important aspect of this evidence briefing is that this age range for girls is much younger than was previously thought, so interventions need to start before they reach secondary school. And as girls get older, their behavioural difficulties increase to almost the same level as boys. I think it was Professor Jess Dayton who said this from the evidence briefing, that these are the new findings act as a wake-up call, not to wait until young people show signs of mental teenagers before interventions take place. So what are the important findings and implications from this particular evidence briefing? Well, the findings point to worrying trajectories for girls as they progress through adolescence. They also highlight the transition between primary and secondary school and the beginning of secondary school as important periods of opportunity for prevention and early intervention. Support and guidance at home or in school may prevent problems from escalating during this critical period. It is through the Headstart programme and the 6 partnerships that we can explore appropriate interventions in this developing area of evidence, ensuring we continue to support the young people most in need and to attempt to avoid the later in life scarring that untreated early mental health conditions can create. If you'd like to know particularly more about that evidence briefing and other evidence briefings that the Anna Freud Centre has produced for the Headstart programme, then if you Google or Headstart evidence briefings, Anna Freud Centre, then you'll come to them. And I particularly urge you to look at those, because there's some particularly interesting findings that I haven't gone in depth today, but I think would particularly help with people dealing with mental health and young people's coping strategies. Also, more recently, this gender difference is explored further through a recent finding from Social Finance, which was entitled Invisible Girls, Why School Exclusions Are Not Gender Neutral. Again, two wonderful articles and pieces written by Social Finance, which start to challenge and look at more closely the gender differences and the gender biases, and start to dispel some of the myths. So it's always the boys that have the behavioural problems, or the boys that get excluded more quickly than girls. So again, I'd urge you to look at that document if you haven't already. The second key area is around genuine co-production. And I use the word genuine because a lot of co-production can be a little bit tokenistic, because genuine co-production takes a lot of effort, a lot of hard work, and a lot of understanding to make sure that there's an equal footing for everyone. So Headstart was originally developed through a proactive effort from the National Lottery Community Fund around 7 years ago to reach out to young people and establish not what was the matter with them, but more importantly, what matters to them. And from this, the fund was given two clear messages that we needed to address: the issues of mental health in young people and the implications of youth unemployment. From these messages, 2 of our 5 strategic programs are developed, namely Talent Match and Headstart. As you have seen and know from the recent pandemic and the recent crisis that we're going through, these areas remain as important, if not more important, than they were messages we first heard from young people nearly 7 years ago. So, co-production through Headstart has to be a system-wide to not only include the young people, their parents and carers, but also the other areas or persons that interact with them. What we've found through the programme is that where we've used genuine co-production through our 6 partnerships, that the young people involved in the co-production activities, it has formed a coping mechanism and a way for them to develop their own self-esteem and confidence. What we've genuinely found, and I found this through the other programme I look after as well, is Talent Match, is that genuine co-production needs to be underpinned by 3 driving principles. The first is that there has to be a transfer of power. They have to be able to do something that they couldn't do before. They have to be listened to and evidence that they've been heard. And there has to be a co-production of outcomes relevant to all parties. This level of genuine co-production will chime with other similar key findings around taking a whole system approach. The importance of a system-wide approach is probably one of the biggest successes of Headstart. And it's around joining up the system around young people from, as I say, the whole school approach to linking into community support and improved collaboration across services from schools to early help to health. There is a need to create a common language and a common approach across the system for talking about young people's emotional well-being. From how to have resilience conversations to ensuring those working around young people in schools and the community have a shared understanding and training in trauma-informed approaches. And this is something that's been pioneered across the 6 partnerships that you'll be able to engage with later today. We found that the key ingredients required for the whole school approach, it needs to be a whole systems approach. It can't just be the schools, but community and services all working together. Senior leadership buy-in needs to be there to enable change at scale. Delegates will probably already know this, but Headstart can demonstrate how it is working. The final area I'd like to talk about is a concept of a trusted place and a trusted person, especially for those young people who lead complex and chaotic lives. For these young people with complex and chaotic lives, a trusted place coupled with a trusted person is often missing in their lives. This significantly reduces their abilities to create an escape or outlet mechanism for their problems and issues. We found through our other young person interventions that a locally trusted organisation will have a greater impact on success, as the young person has to have a trusted connection with the place of intervention delivery, be that a specific location within the school or even away from the school, to truly engage in the programme. This has to be coupled when making the connections with the concepts of a mentoring approach, and this across the Headstart programme and others within the National Lottery Community Fund has shown to have a positive impact on the young people as they're able to create that trusted person status, creating the stability, support and encouragement. Again, key factors that are often missing in young people's lives. We found that this, coupled with what we call a PACE approach, which is play, acceptance, curiosity and empathy, can significantly increase the successes of these interactions and ultimately positive outcomes for the young person. So as I say, to me, that's a bit of a whistle-top tour of what Headstart does. And I know from working closely with the 6 partnerships that they'll be able to tell you some of the innovations and changes in working they've been able to do to deal with the pandemic, which they've done with gusto and success. But for me, to conclude, inspiration and the determination that young people show through Headstart are learning and developing techniques to not only improve their own mental health and well-being, but the mental health and well-being of the people who are closest to them. It's these collective successes would not be possible if there was not a genuine belief in the Headstart programme and the difference it is making. As I've said throughout the little presentation today, I hope through this conference today you're able to evidence the difference the programme is making and the positive impact it is having on the lives of young people and those closest to them. That is, as I say, a bit of a whistle-top tour. Thank you for listening to me, and I'm more than happy to take any questions that anyone has.
Thank you so much, Scott. Unfortunately, we haven't got time for questions, but maybe what we can do is if there's anything in the chat that hasn't been picked up, that is a sort of a question for the national lottery as opposed to the individual sites, then I'm sure Scott will be happy to pick those up via email if we can set that up. Scott, is that all right?
Yeah, 100%. Yeah, and also, as I say, I'll share with yourselves as NCB, Amanda, some of the other resource links as well, so we can share those out when the final presentation goes through.
That's fabulous. Now, for some reason, it wouldn't let me move on to the next slide that I've got, which is about, oh, there we are, which is about the workshops. So anyway, thank you so much, Scott. That was, I think, just gave us a really good framework for what people are about to move on to. So so these are the workshops that you should have had a link for. And I'm not going to go through them all because I know that they've already started because I've already had an alert for the one that I'm supposed to be in. So thank you so much for joining us in this plenary session. When you are in your second workshop, you will have a link to a feedback form, which we would absolutely love it if you would fill in, because you know, we're always trying to improve the way that we do these things. So we just want to make sure that if we're going to do another one, that we base it on the learning that we've had for today. So thank you for joining us. Enjoy the workshops and don't forget to do your feedback form. It's been lovely spending time with you this afternoon and hope to see you all again soon, maybe even in real life. Thank you very much.